because we have to, before getting the drill, before getting the filling, we'd better to know about the patient. Approaching to the elderly should be much, much more patient-centered.
Hello, everyone, and welcome to the All Pulp No Fiction podcast, where we discuss issues related to the dental community worldwide. Best of all, we do our best to host guests who have deep and extensive experience in their own fields. So, information you have here is evidence-based. Full disclosure, this podcast is supported by GC Corporation and is directed towards the dental professionals worldwide. So if you're not a dental professional, please refrain from listening and watching the podcast. Without further ado, let's get to today's episode. First of all, thank you very much for your time.
Thank you for having me.
You're a very busy person, and I know that, it was not easy to make time for our podcast. So
it's my pleasure to be here.
Yeah, thank you very much. I wanted to introduce you by myself, so say a few things about you, but I know you're the director of Osaka University's Dental Hospital. You are a professor at the head of Department of Restorative Dentistry and Endodontology, but there are so many things to say, so I don't think there's enough time to say all of them. So if you would, introduce yourself to us and to our listeners, how would you introduce yourself to us?
I'm a dentist.
Yeah.
Obviously. Then I want to be a pioneer to change the attitude of the clinician in this country.
I see.
Perhaps because of the national health scheme, that is very good in Japan. However, we should move on to the much more preventative way.
I see.
So what I'm doing is to make a movement.
I see. Thank you very much, Professor. If I can go back with you in time, so what got you interested in dentistry, generally speaking? We're going to talk about your research and things that you're doing right now, but before that, why were you interested in dentistry in general?
Thank you for asking that. Actually, it goes back many, many years ago. When I was a child, I got a very, very bad teeth.
Oh, I see.
I have to go to the dentist regularly. However, it won't stop. So in my childhood, I wonder, why should I go back and again and again?
Yeah.
Even I'm brushing the teeth regularly. Then I have learned way of learning or maintaining the teeth should be different. Then I want to be a dentist to make it better.
So the problem was not that you're brushing your teeth. The problem was like the way that you were brushing your teeth. You should have learned it, maybe the way that they taught you would have been better.
I think, of course, the way of brushing was not perfect, obviously. However, I believe we had much more effective way. And then it was more than 50 years ago. So many child have to go to the dental clinic.
Yeah.
In that time, we called the pandemic of the dental caries for the childhood in this country. So the dentists work very, very hard to look after the children, but the way of doing is not the ideal way, I believe.
I see.
But in my in my feeling, I feel something wrong in here.
I see. And I think this have affected, the way that you look at dentistry, and definitely, maybe directed your way, because I know that your research and the work that you do has a lot with preventive dentistry and the use of minimum intervention, right?
Yes. Then I move on into the dental school.
Yeah.
Then there are lots of attractive field, such as prosthodontics or denture.
Yeah.
So I wonder what is my best way to go. And then in my final year, I met with a very, very skillful, talented woman dentist. So I thought I should be like her.
Yeah. What was she, what was she doing? What was, you said she was very talented. So
she's an operative dentist specialist, and then she is almost genius to restore the teeth. Actually, I still see her restoration even after 30 years. When I look after my patient who was looked after by her.
Oh.
And then also her way to the, her attitude treating the patient is very friendly, but she finds the core part why the dentist come here. So I admire her, and then I want to be like her.
Yeah. So, and how can I say, like, after that, after you were in dental school, you got inspired by this, very talented dentist. Why did you decide to go to, graduate school? Like, not many people, enjoy graduate school, right? What was your motivation behind that?
Actually, I didn't go to the graduate school. I got a PhD after the graduation and continued the clinical work for 10 years.
Oh, I see. Yeah.
It is coincidence because the topic was the GC's ceramic inlay.
Oh, I see. So that was a very good coincidence.
Yes,
I think,
yes. Yeah. That is very, very new for the restorative world. So I was fascinated to make a very much natural alike teeth.
I see.
Without big invasive way.
Yeah, I mean, it's very important to keep in mind that our job as a dentist to preserve the tooth. I mean, how can I say? Many people become very interested in, the techniques that they learn, but eventually our job is to preserve the tooth and try not to hurt it, with the most of our power. So can you tell me a little bit about your vision for for dentistry and the use for minimum invasive dentistry? I know that many of your lectures is actually about dealing with elderly patients, right? And how does the concept of minimum intervention lead the conversation of geriatric dentistry and take care of elder patients?
All right, that is very interesting but difficult question to answer, because we have many approaches to the elderly people, and then elderly people already gotten a lot of history by themselves. So first thing is the elderly people usually want to be a very conservative treatment, not on a very aggressive, invasive one. Of course, we got an exceptional one, but then I believe the minimal intervention dentistry is good because the fundamental core is knowing about the patient. Because we have to, before getting the drill, before getting the filling, we'd better to know about the patient. What is the risk of the individual? What kind of oral conditions they have? So we should seek the best way to maintain the oral condition. As far as I understand, the approaching to the elderly should be much more patient-centered. Of course, patient-centered is a fundamental way to approach to the patient, but elderly people has a background and history. We should learn more about that. And the minimal intervention is one of the key approach to do.
I see.
Then, if needed, of course, we have to do the emergency treatment, or somebody need an implant or the denture, we should do it. But starting from the identifying the individuals, the risk or the background and their demand.
I see. Oh, and I think Japan is like, I think the whole world knows, like Japan is, has a very large population of, elderly patients. In your perspective, what steps did Japan take to be at the forefront of this field? Because I think, Japan has progressed in this field maybe a bit more than other countries. So what is Japan doing right in this field?
Right.
And what is it not doing so well?
Well, you said we are calling our society super aging society.
Yeah.
In 2050, almost 40% of the Japanese will be age over 65. So naturally, we should focus on that because of the majority of the population is very aged.
I see.
So it happened to the advanced country. According to the other survey, the Taiwan is following us. Also, the South Korea is going to follow us.
I see.
So what we should do is to make a policy such as 80-20. Perhaps you know, 80-20 is a Japanese policy, working together with the Health Ministry, government, plus the Japan Dental Association. It started more than 30 years. 80-20 meaning keep 20 or much more natural teeth at the age of 80. So according to the survey, 2017, more than half of the Japanese elderly achieved that.
That sounds great.
That is good, but we should know what kind of quality. That is another thing.
Right. So it's not just enough to have the numbers, but how is the condition of the teeth?
But people get aware the importance of keeping teeth is good. Because, again, some epidemiological study showed if we got a good oral condition with many teeth, they have a good healthy life, healthier than the people who lost the teeth a lot.
Yeah. So it's kind of interesting that, with the advancements in healthcare and in technology, patients are living much longer lives. But at the point that we're living right now, maybe it's very important to pay attention to the quality of their life more than just how long are they living, right?
Yes, that's true. And then as to the quality, how's the quality of the oral condition? It doesn't mean a lot if we got a very, very hopeless teeth in the mouth.
Yes.
So, as I said, after achieving the certain success of the 80-20, the Japanese Association for Oral Health set a target through life 28. When we see the real world, there's a lot of patients who already lost teeth. Even so, with the help by the implant or the denture or prosthodontics, meaning bridge, keep the good dental condition with 28 teeth. That help to do the healthy good life.
Right.
So, of course, the elderly people can eat without pain, and then can speak, and then it affects the socialization, and then nutrition will be affected if we got a good oral condition. So I think we hope to move forward better after setting the other target like this.
I see. Like you mentioned, like when patients get older, like they're, all aspects of their life are important, and maybe even their diet has to change. And having their teeth, having, at least most of their teeth at the age of 80 would help them achieve that goal, especially, if any house that has an elder person in it, I think they are taking kind of special care to the dietary, requirements of this elder person, right? And what do you think? What should be like for the general population? What would be the steps that they should take, or like general population, in general, and dentists especially, to help these patients grow older with more teeth? What kind of steps are applicable?
I feel that is the wrong way to go. However, when we see that kind of problem, we have to approach from the dental dental specialist as well as the patient. Also, we have to get a good approach by the government. Add to the dentist, as you said, minimal intervention is a good way to start because minimal intervention is to know about patient more. Then we're going to start from the caries management, and then in the age around 35 to 40, 50, we are going to focus on the periodontal disease as well. Then we should look after the patient from the infancy to the adolescent and the adult and elderly. We should continue it, not only seeing the elderly alone. Of course, we have to deal with them. But when we see the long perspective, we should start from the baby.
Yeah, right. Yeah.
And also, I want to emphasize on the awareness of the patient. Patient should learn, should know the major oral disease such as caries and periodontitis is preventable. Basically, they are preventable.
Yeah.
That's why the care should be started very early. According to the interesting survey by the magazine or the paper, a majority of the regret of the people in the society, maybe mostly adult, they say we should have gotten a dental treatment earlier.
I see. And it's quite interesting, like in Japan, like what health insurance is quite affordable, right?
Yeah,
like
yes.
It's very good. It covers basically everything. So in your opinion, why do patients patients who do not take care of their teeth, what are the reasons behind that?
It's a very hard question to me as a dentist. But actually, majority of the patients still do not want to come to the dental office because of the bad image of the drill and fill and the pain.
Yeah.
So that's why still many patients come when they have pain alone. They don't come regularly. And then because of the budget limitation, that is the real world.
Yes.
So government gives a payment for the invasive treatment alone.
I see.
Of course, the dentists have to continue their own business. So they are much more invasive oriented rather than preventative. However, when we see last 10 years, even 20 years, government has changed. Based on the experience of the 80-20, government and of course the dental association, dentists learn the importance of the prevention. That's why the government gave the payment for the maintenance of the periodontal disease as well as caries. That is very, very good movement. And then, but when I see the Scandinavian country, they already introduced the capitation system, meaning give the money to the dentist or dental community according to the number of the patient who keeps the healthy teeth. Give the reward.
Oh, I see.
I think that is a next movement to do, even that is challenging.
That is quite interesting concept. Yeah, I feel bad for not knowing about this earlier.
In Sweden, they got on a trial activity there. I have to learn what kind of
what were the outcomes, right? When you were speaking, like you said a very interesting thing is that, many patients avoid going to the clinic because of the bad image, the pain, the drill, the feeling. How do you see what can be changed in our daily treatments? I think pain management is one of these aspects, is that we should, there's, as a dental community, we should try to find solutions to make patients suffer less, at the clinic. Like
I totally agree.
I'm a dentist and I even get scared when I'm sitting in the dentist chair. So in your opinion, what are the steps that we can take in order to kind of make this a more, less traumatic experience for the patients?
Yeah, of course, one important factor is a skill, right? As a basic skill as a dentist. But if we have no drill treatment, but we can maintain the oral condition. And then we got a respect by the patient, and then we accept it to do something better. That is an ideal world.
Right.
But when we see the oral condition, there's a lot of initial caries without cavity, so we have to identify it. Not only for the child, but also the elderly who got a root caries.
I see.
So we should identify the background of the initiation of the oral cavity. So we have to change it.
So from what I understood from you, like not, treating actively, but actually going behind the reasons also is quite important,
It's
right?
important. And then also, sorry for interrupting, but I forgot to tell you, but in terms of the root caries, not necessarily need drilling, because we can control it without drilling. That is totally different from the enamel and dentin caries. The root caries is one of the typical condition which is manageable, controllable, if that is an initial stage. No, not drilling, just a stop.
Just by resting it.
That is an not invasive way to treat.
Can you elaborate on that point a little bit? Like, how does root caries differ in, treatment from, typically caries that we find in the crown?
Yeah, okay. Actually, maybe you understand the ICDAS, right? The to identify the caries, the crown caries and root caries. According to the ICDAS, when we see the root surface with a cavitation less than 0.5 millimeter, we can stop it with the high concentration fluoride or the daily brushing. And then when we see the cavitation deeper than 0.5, it's better to fill as usual way. But when we identify it with a regular checkup, we can manage it without invasive way.
I mean, you are working in a university hospital, right? And how do you see the coming generation of dentists? Are they interested in geriatric dentistry and minimum intervention, or are they focused on more, invasive treatments that can pay them better? So how do you see, what's the direction of the younger generation?
Should I be honest, right?
Yeah, please.
Yeah, actually, the young generation want to do the surgical treatment, such as implant, and then if somebody want to do the comprehensive treatment with the prosthodontic restorative treatment.
Yeah.
And then in my department, we are doing the endodontics too.
Yeah.
They are quite keen to know the modern endodontic technology too. But however, in any stage, the minimal intervention is a key, fundamental approach to do.
Yeah.
So as an university teacher, I'm going to emphasize the importance of that. And then after learning that, the young generation can go anywhere if they want.
So how do you direct the research subjects, in order, I want to speak from point of view of a student, because, I just finished my PhD a little while ago. And sometimes, the needs of the students, or like somebody who's applying for a PhD, and the direction of the, the program itself, like how do you make them meet? Like you said, like you're interested in minimum intervention, and how do you direct the research in order to still have that, preservation of tooth and minimum intervention concept in it? while allowing the the students to actually do the research that they're interested in?
Yeah, actually, it depends on the individual. Some some students want to do the basic research about how the careers progress in the level of the not in the nano level or something like that with a very advanced technology. But majority of the young people join us who want to do the clinical work as well as the research work too. So if some individual already gotten a focus on some topic, I want to encourage them to do. But in my university, luckily to have the many departments such as engineering and science or the medical profession there, so we can collaborate and they make the research much more advanced.
I see.
For example, in the case of the cardiology research, we are doing the effectiveness of the material or something with seeing the mineral loss or the lesion depth, but we don't know how the dynamic ion movement or the elemental reaction. So with a time course, so such kind of approach would stimulate the young people.
I see. So you look at it from a bigger perspective and also on a very small level too, right? Yeah. That's actually, that's very interesting.
Because I'm in the research-oriented university, so we have to seek the new aspect, have to open the new door.
Yeah. And in your opinion, like research that is like, research we have to get funding to do research, right? So subjects that are related to intervention, minimum intervention, and geriatric dentistry, are they popular? Are you able to produce a lot of research compared to the subject?
Thank you for asking that. That is a very competitive world because the rival is doing the stem cell research,
right? Yeah.
Or the producing the new teeth.
Yes.
But the patient, the general people want to achieve the non-drilling treatment.
Yeah.
That appeal to everyone. Then when I applied to the big funding, I always quote the minimal intervention with a very advanced scientific technique.
See.
As I said, such as synchrotron beam with nanotechnology, something like that. So we can make the situation different.
To get an advantage on these other types of research, right?
And then if the even non-dentist judge to see in this world, there's no drilling treatment, that is very attractive.
Yeah, I mean, it would make a lot of dentists go out of work, but
Well, in that case, as I said, the capitation reward system should work.
Yes.
Because that is much more, what should I say, admirable way of approach.
Yes.
To keep the patient healthy.
Right, yeah. I mean, honestly, like, I feel bad for just hearing about this right now. It's a very interesting concept, and maybe it should be a lot more popular, than.
But as far as I understand, it's not yet big success because have to persuade a lot of layers.
I would expect that too. But it's a very good step, like a different way of thinking compared to what we have right now, right?
That's still quite similar to the insurance system. If we are the good driver, we can pay less, right?
Yes, yeah, this is very good analogy. Yeah, thank you very much, Professor. I prepared a few questions over here, but I think we already went through some of them already during our conversation. One of the questions over here is like, relation of healthy dentition with healthy oral functions. I think it goes without saying that, healthy dentition results in healthier, oral functions, and How do we help the population understand this concept? Because some patients will just, will not think of this condition as on the long run. They'll be like, maybe, I don't want to brush my teeth today. It's fine. This kind of thing. But what are the steps that, dentists generally can take in order to portray this idea to the patients?
Right. So first of all, the function, meaning the good eating for the patient, the speech, or what should I say, sing a lot. But to do so, of course, no symptom of the information. That's the first step. So dentists can help.
Yeah.
And then when we see much more socialized level, eating at the same speed as a family, or eating preference, such as avoiding the chewy French bread or something like that. So we'd better to continue the dialogue with the patient. It is not easy to give the proper advice when we see the patient only when they came with a pain or something. So the concept of the government, maybe you have heard the government try to develop the regular checkup for everyone.
Oh, yes.
I'm not sure about the budget of that, but that is the right approach to know the function. Function means it won't improve so quickly. It won't deteriorate so quickly. It comes gradually. For example, when the patient got a neurobrain complication, such as Parkinson, such as dementia, so it came gradually. So when we see the patient regularly, maybe we can understand that. Also, when patient got on a medication for the depression, the muscle would be affected. So not easy to chew. So the collaborate with a physician is important factor to do. Also collaborate with the patient with a long range. So that is my view to analyze and evaluate the function.
And I see like one of the problems with with elder patients and who have bad oral functions, like it results in oral frailty, and I think there's a good part of it and a bad part. Like a bad part, obviously, patients losing their functions and generally in their general health, as a result of that. But this is a process that is also reversible. So like, we are able as dentists to take care of that, right?
It is. Yeah. But as a director of the hospital, I was amazed by the very, very professional skill of the specialist of this field, the oral function specialist, how to train the elderly who has a stroke or even dementia. There's a special skill to train the patient. So I think people have to learn more about it. But unfortunately, there's not a lot many specialists in this field. In that kind of things, I would think using the IT technology, remote lesson or lecture, e-learning should be popular more and more.
I see. I understand. Like you mentioned, like there are specialists for this kind of special cases.
Yeah.
But talking to the dentists out there, GPs, especially people who just graduated, what would be your advice for them to try to take care of these patients, or at least how do they start to identify patients who might have bad oral functions?
Of course, the eating food will be changed, right? When they got low function, and then you can see the frail when we see the face of the movement of the jaw, and then I understand GC company already developed the muscle training system.
Oh, yes.
So that is very, very good to do. And then when the patient got on a problem such as aspiration pneumonia, they must to see the specialist, analyzing the function by the inner scope, and then judge how to do it.
I see. Well, thank you very much, Professor, for your time today. This was very educational for me.
Thank you.
I'm pretty sure everybody who will be listening to us will also learn a lot from the information that you've provided us. In the end, would you like to share with us any kind of information or any advice for people who are interested in minimum intervention and in geriatric dentistry?
Oh, thank you very much for asking that. And I enjoyed very much today. And then, first of all, the minimal intervention, as I said in this interview, that is a key idea, patient-centered care. So it is not only the young people, but also the elderly people. And they should be in the center of the society, in the supervising society. So they have to get a main role. But if so, they want to do the healthier life with a good oral condition. I think the regular care checkup is a best way to do.
Okay, then. Thank you very much, Professor.
Thank you very much. Thank you.